Well, welcome everyone. This is our first optometric education diplomate prep course that is virtual. We've been giving the course for a number of years at the Academy and thought we would do it at different intervals and offer a virtual option as well. So let me introduce Dr. Marley Spafford from Waterloo and Dr. Daniel Taylor from Ferris State College of Optometry, and I am Aurora Denial from the New England College of Optometry. So we are on the committee, the Diplomat Committee, and we'll be delivering this lecture today. And we hope that it's a real sort of almost informal where you're free to ask questions and interact in dialogue and actually get to know people. And if possible, if you would like to turn your cameras on, that would be great. We would welcome it, but I certainly know that sometimes that doesn't happen. So that's fine too. Okay, first thing, just so we establish our expectations, our learning objectives, and you can certainly read about it. We want to talk about different types of academic writing. In particular, this is useful anytime in your career, but also in relationship to applying for the Diplomate program, if that's something that you are interested in. So these will be the things that we're going to be talking about. Once again, types of optometric education, and then a little bit more in depth on identifying different articles, their scope and storyline, and actually then some writing steps as well. Okay, so just as a little icebreaker, I wonder if in the chat, maybe you could just put your location. And if you want to just write maybe one strength and challenge that you've experienced in writing academic articles, that would be great. And then we'll just talk about levels. While you're doing that, I'm going to identify some strengths and challenges that I've experienced working with other faculty members. And a challenge that always seems to come up is time. Allotting time for scholarly activities seems to be a challenge for everyone. And then the equally important challenge that seems to always come up is being formally trained. People sort of don't know how to begin, what they're doing, and they feel very lost. And because of that, it's not, maybe high on their comfort level. And then it gets sort of, the things that are not high in your comfort level are sort of on the back burner. Strengths, people bring different strengths to writing. Some people have a lot of past experience, maybe in a master's or a PhD program. And some people are just very creative and enjoy the process. So let's just have, if we can, a show of hands, and you can either raise your hand physically or use the raise hand button. I mean, how many people have very little experience? Okay. And how about, okay, and moderate experience? Like you've had some, but not a lot. Okay. And then anyone with a lot of experience, like maybe you've had a different kind of a PhD program or something. Okay. All right. So someone there was experience versus their passion in terms of a strength and a challenge, and that certainly happens. Experience, and once again, that formal training is really important, and it's hard because you're sort of, you're thinking, where do I begin? How do I get feedback? How do I know if I'm progressing? All of those kinds of things. Any others that you would want to comment on, Marley, in the chat?
Well, in this screen view, I'm unable to see the chat. So I'm wondering if Daniel, you could pipe in and what you're seeing in the chat,
Sure.
what people are.
The only thing was one of our people said joined from Australia. I think this is the one you mentioned, Aurora. Challenge is less experience. Strength is my passion towards optometric education.
Okay. Well, as we move along, we can talk more about these different strengths and challenges. And as I said, I want it, to be sort of informal and a nice experience, a nice conversation. So let's get down to talking about different types of optometric education scholarships, scholarly material. So there's certainly data-driven studies, which we are all familiar with. Educational reviews, which obviously are very similar to like a systematic review, And then teaching case reports, which are a little bit different, I think, than a regular clinical case report. And we'll definitely go into a little bit more detail about that. So, do you want to go? There we go. Okay. So data-driven studies can take different forms. One is the scholarship of teaching and learning, and that is where your classroom, your lab, your clinic is really your area for research and where your research questions become developed. And really the goal there is to improve both teaching and learning. So that is really immersed in what you're doing, your passion, how to teach better, how students can learn better. Discipline-based educational research, of course, is broader. It could be any subject matter, and you could use a larger group than just your local class or clinic or lab. You may be talking about something like AI. It's really how do students learn in general, like a discipline, what's the best method for learning? So much broader um, based research than the scholarship of teaching and learning. Both are valuable. The scholarship of teaching learning really is to publish and put out there for peer review scholarship so that decisions can be made going forward. Very similar evidence-based teaching, evidence-based optometry or medicine. So those two are a little bit different, and both are really great areas to develop research in. Okay. That's
A little comment, Aurora. We have
Yep.
another comment here from Dr. Elkins, who is in Memphis.
Okay.
She mentions that her strength is experience in optometric education, and her challenge is expanding from poster level to articles.
Oh, excellent. That is, I think, actually very common. You know, we are educators. We are, that is our passion. Um, but once again, that abstract, that published abstract, developing it into a formal paper that's put out there for peer review, the whole process, it can be challenging and even a little intimidating for some people. So I thank you. That's an excellent comment. Okay, Marley. Okay, for any writing, I think these are just sort of really good things to review. They're almost common sense. Please choose a topic or project of interest. It just makes the whole experience so much better and so much more interesting. It's like anything, the more engaged you are, the more invested you are, the time goes by quicker and it really produces a better outcome. Collaborators are wonderful. Sometimes it's hard for individuals to once again motivate, but if you're working with someone, you may have the motivation there. You want to do a good job for someone else, but it's, someone else may bring some strengths that you don't have. So collaborators can be really, really helpful to a project, getting it off the ground and then progressing. Always do a relevant literature search. Once you have a research question or you're thinking about a question, you want to see what has already been published. That is sort of an essential, a beginning first step. You need to know what's already out there before you can really frame your particular question or even frame what topic you're going to be using. Choose an approach. Think about really, are you going to use your classroom, your clinic, your lab? Is it going to be a teaching case report, which we'll talk about in just a minute? Is it going to be a broader educational review or a data-driven study? One word about educational reviews, they always seem like it should be, well, that, reading, gathering together information, they actually can be very challenging to do. I have found that this is where librarians and the library is a tremendous resource. They just seem to have a lot of information and can be very helpful. So if you do choose that route, definitely educate yourself on how to go about doing that type of research. And I would encourage everyone, actually for all of these, to utilize your library resource. And one last point about ethical review, IRB. Most educational studies are exempt. However, I would encourage everyone to submit to your IRB. You want your IRB to say it's exempt. Wherever you publish, they are going to ask for that. And also, sometimes the IRB can be enormously helpful in giving you feedback on your proposal. So it's a mechanism to get feedback, and it will formally tell you that it's exempt or not, depending on exactly what you've chosen to study. But I would absolutely, even though, amazingly, if it is exempt, it can be self-declared exempt. I would not go that route at all. I would encourage you to utilize your IRB. They're there really to help you. So definitely do that. And as I said, almost every journal will ask, did it go through an ethics review board? Okay. Couple of other things. Consider the target audience. This is important. Who do you want to reach? And I remember at one point in my career in writing, I had a choice between optometric education, and I knew that my colleagues would receive the information that I had written versus a journal that was, I think it was called The Teaching Professor or something, which I didn't think my colleagues would actually encounter, but I knew other people in other disciplines would encounter it. And I really had to decide, did I want that broader audience or did I want my optometric colleagues? And that's important because it was a little different. I actually chose the broader audience, and that educational journal had publication guidelines, and you always want to check those before you go ahead. It will tell you about, the audience of the journal, the specific format that is needed, and it's an important, it needs to be a decision. You should not just default to one journal. Make it a decision process and look at all of the pros and cons, which always occur. Avoid predatory journals. Once again, I cannot tell you how much the librarians can be helpful here. With the internet, we now see a lot of predatory journals that are just there for financial gain. They have limited or no dissemination. They look almost identical. Their titles can be identical, and sometimes they can actually be quite difficult to distinguish. So just be aware of that. And I'm sure we've all gotten solicited by these journals. And just be aware of that when you're publishing. Okay, the article story. I have always felt that an outline is important. And in your mind, think about what story do you want to tell. Keeping an outline can also really help you with time frame and set up some deadlines. It gives you a goal. You don't have to keep them necessarily, but it does let you know where you need to be at different points, and it really helps to keep you on target. Okay, I wanted to get to this slide to talk a little bit more about teaching case reports. So teaching case reports, oh goodness, came about probably about 15 years, if not, well, more than that, 20 years ago. It was a former editor of optometric education, Elizabeth Hoppy, and actually one of my colleagues, Dr. Barry Cran, that thought of this idea. And what they thought of is, let's take a clinical case and add to it how to teach the material. And let's sort of marry the two, and they became a teaching case report. So unlike a clinical case report, which is just the clinical entities and research and discussion about that, this really had another element of really, how would I teach this material? How would I assess it? What questions would we ask for discussion? How would we maybe give feedback? How would we assess? Now, a teaching case report, clinical cases a lot of times really want your more complex, rare, unusual case that may or may not come through your door. Teaching case report, that would be great if you had that unusual case, but it could also be something much more mainstream and common, presbyopia, glaucoma. A good case starts with a good clinical case report, but that educational piece is essential. How would you teach it? Is there a new or novel way? How would you really lead the discussion? What questions would you ask? And it really is an exciting way to look at your teaching, And also, you're teaching, if you do submit it to optometric education or to the Diplomate committee, you will get feedback on your teaching. And I encourage people to use that in, maybe they portfolio or something of that nature. So just to summarize again, the data-driven studies, the format is keywords, abstracts, and intro, the main body, which is methods, results, discussion, conclusion, acknowledgement, and references. Teaching case reports, similar at the beginning, but obviously a case description, which is your clinical case. Very important educational guidelines, and then the discussion, which is both discussing the thinking and thought process having to do with the clinical case, as well as the teaching elements and why you would choose those particular teaching elements. And then, of course, our educational reviews. Once again, keywords, abstract are the same. They're organized by theme, number of different ways you can go about that. But those can be tricky. So definitely, think about your resources, who's available and who can help you with that. Okay, very briefly, because I think that Marley will be going over some more of this. Once again, your methods is your ethics approval, your subjects, how your data was analyzed, how it was gathered. Could it be repeated? This is the section where if someone wanted to repeat your experimental design, they could do that. So you do want to be very specific in giving out information. Results, be straightforward, describe your key findings, tables, figures, all of those things that can make it easier, please do so. But they should be the very straightforward results. But the discussion is the fun part. I love the discussion. It really is where you give meaning to the data. It's where you tell your story more. It's where you can hypothesize, be creative, be interesting, talk about the results, what they could mean. Obviously, you're going to be talking possibly about limitations also as well. And I find that this is, I mean, it's all fun, but this is probably your most fun part, where you can have that sort of creative leeway and really get into what does it mean? What does all of this mean? Okay, we have the main body, and this would be our teaching case reports. And once again, that case description is a clinical case report. But the educational guidelines is when you sort of get into that nitty-gritty of the teaching. Obviously, we want learning objectives. What do we want the outcome to be? Key concepts, which are very difficult for most people. It's really what are those underlying key concepts, which if you understood, illuminates the topic. So an example would be if you're talking about an eye infection, maybe having a broad understanding about sepsis, how a tissue gets infected by a virus or bacteria, and then how it damages, maybe very illuminating in terms of that topic. Discussion points. What questions should you ask to once again guide your discussion? And then, of course, the teaching method that you might want to use or you might want to discuss. Maybe it's a problem-based learning method. Maybe it's a large lecture. Certainly anything else for assessment or any other tools that now we use a lot of things like surveying, kinds of creative things as we talk about cases. The discussion, once again, is the fun part, although it's all fun, but it's a lot more about one, your thinking, your thought process in arriving at your diagnosis and treatment, and also related to your teaching. Why are you choosing this method? Why are you asking these questions? But definitely that's where you're talking about the decisions that you made in your case. And once again, weaving in evidence-based practice or other cases that are relevant or other topics that may be relevant. Okay, is there one more mode? Yeah, there we go. Whoops, I think that was the same one. And this is just educational reviews, and they can take a number of different forms. Topic, it could be a sequential time or a method related to obviously a teaching pedagogy. I cannot emphasize enough that this is definitely something I think most of us would need to reach out for resources. And because you want to be efficient, you do not want to waste time. You want to really key in on people that can help you and what you need to know in order to implement a good educational review. All right, I think that's all I have to say at the moment. I'm sure I'll say more later.
Great, thanks very much, Aurora, making sure that I can be heard. Can you give me a sign there, Aurora, that people can hear me?
I can hear you, Marley. Great.
Good, thank you. So thanks, Aurora, for giving us that foundational information. And now we're going to really talk about your approach to writing. And you're going to see me making reference to Lorelei Lingard regularly in this. And Lorelei is a medical education researcher in London, Ontario, Canada. And she's written widely, and you may have come across some of her work. And she has a lot of interesting things to say. And one of them is when she's giving workshops on how to write medical education articles, she'll say, write to be read rather than write to be published. Certainly, some of us in our professional obligations, there's a reason why we want to publish for promotion or personal satisfaction. But it's not just getting it published. If you write it so that people want to read it, so it's really draws them in, that will actually help you in the review process to get published, and it'll help you with citations. So your approach to writing is write it to be read. I know I've said this and heard a colleague say it sometimes. So I just need to write up that study. I did it, and I just got to write it up. But you're really not writing up a study. A study is a part of your article, and we're going to get more into that and why you're not just writing up a study. What you really want to do is tell a story about a problem that matters to people, that interests them. So if you think of an article that has an introduction, a methods, a results, and a discussion, sort of a standard setup, then really your introduction and your discussion, the bookends, are the story. You're writing about something, a problem that matters to people and they're interested. And then you're using some study that you did, and you describe the methods of how you did it and the results of what you found that showcase and give us a better understanding of that problem that matters. So if you write an introduction with these three things in mind, that in the first paragraph, or maybe 2 paragraphs, you try to address these 3 questions. That you say, what is the problem? You identify for the reader, what is the problem that you're writing about? What's unknown about the problem? Or we could call it the gap, the thing that has not been studied or looked at yet. And then, why does that problem matter? What's the hook? Why does your reader care to keep reading? If you can get them right at the first of the article, they want to come on the journey with you. And so I'm going to encourage you, and we're going to talk about this more, that kind of style of writing. Then your methods is, what did you do? Why did you do it that way? And you're laying it out in details so that someone could come along and replicate. And then results, what did you find? Have you presented them convincingly? And Daniel will talk about this more later. And then your discussion is, well, you identified in your introduction some gap in this problem. So how have you addressed that gap? Have we learned something new from your study? And how could we reframe now the problem based on what you've done? And why does it matter? Why do we care? What's useful to optometric education because of what you've done? And then it's always nice to have a kind of what's next, what might we want to look at? So thinking about the path you're taking along through this article, that you're writing a story using a study in the methods and results. So we're going to talk a little bit more now, drill a little bit more into some tips around writing the introduction. Now, I have put this as an introduction from a published article, not for us to read. I purposely included the whole article to make a point to you. So this is an article, and I am a co-author on this article. And this article introduction perfectly illustrates something called a typical medical education approach of a triangular way to write an article. So if you read this, you would find out that this introduction is about social participation. And then it scopes down a bit more. It's about social participation in seniors. And then it's social participation in seniors with age-related vision loss. And then we get down even finer to it's the environmental factors that affect social participation in seniors with vision loss. So we just kind of narrow and narrow. So by the end of the introduction, ta-da, we've gotten to the point of the article. In fact, if you read this introduction, you'd have to get to the very second last sentence of this introduction, and you'd find out, and we're going to read it here, a scoping review that addressed factors contributing to decreased participation among seniors with age-related vision loss found that research has primarily focused on individual factors such as demographic, age, gender, and vision-related type, severity of vision loss, diagnosis, characteristics, with, and the underline is added, with minimal attention to environmental influences. Second last sentence, we tell you this is actually what we're interested in. This is the gap that's not been looked at. It's like we've written a mystery novel and we buried the lead. You have to muscle through the whole introduction to find out, oh, that's what they care about. So this is a style of writing you'll see in many papers, and it's very valid, it's well accepted, but there's a better, more compelling way to do it if you can sort of say, I'm going to just flip the triangle, I'm going to invert it, and I'm going to start with what really matters at the start of my introduction. And this kind of approach that I'm talking about has been called in the literature the problem, gap, hook, heuristic, an approach where you identify in that first 1 or 2 paragraphs, what is the problem? What's unknown about the problem or the gap? And why does this problem matter? Get the reader at the start. And if you do that, and you're clear about that in your mind with you and your co-authors, then what's left to say in the introduction becomes clearer because you've set up you've scoped it out, and now really it's going to be easier because sometimes we read introductions for articles where that you can tell the writer felt, I have to say everything about clinical reasoning education, everything. And it's a very long, winding introduction. But there's something about clinical reasoning that this author is interested in, and that's what you're going to identify right at the get-go. If you think about writing your introduction, it's a story, and the purpose of it is to engage in a conversation, to enter a conversation with your readers about something that matters. So you start with a problem, identify the gap and the hook, and then the subsequent literature review, the short review that you put in your introduction, is kind of about the knowledge and thinking about this problem. And sometimes we can call that mapping the gap. And I'll say more about that in a moment. Now, I do want to make a differentiation between having a topic and talking about a problem. We're encouraging you to, in your writing that you're doing and going to do, to think about articulating a problem. But I want to have you look at these two contrasting statements. On the left, we have a topic. Imagine that the article started with team communication plays an important role in patient safety. Well, we have some good idea of where this article is going to head in a general sense. Sounds like patient safety and team communication are important, but we don't really know it could go in a lot of different directions. And we haven't really problematized the issue. We've just said it matters to have team communication for patient safety. But now look on the right side. What if we wrote it as a problem? We are able to articulate it as a problem. And here the example is adverse events resulting from error happen at unacceptably high rates in hospital, and ineffective communication among team members is often a contributing factor. To me, that's a more compelling example. I have a much better idea of where this article is going to go. I have a setting in hospitals. I know about team member communication as a contributing factor, that I know that error is at too high a rate. So I've got a problem now, and presumably then next in the article, we'd start to identify a gap. So start with the problem, because it is going to set the stage for you talking about something that matters to your readers. Now, what we'd like you to do, using the chat feature, after you think for a moment or two, we're going to give you a couple minutes to do this, is to start thinking there's perhaps an article you're working out right now on optometric education, or you're thinking about it, or you're not quite at the writing stage, but you're just kind of, you're a bit aspirational about what you'd like to talk about. So use a chat feature to say, what's a optometric education problem that you'd like to or are writing about? And if you feel like I haven't really articulated what the problem is, I think I'm more at a topic. That's where I know the topic I'm interested in. Write that. That's okay. Just indicate the topic you're interested in. We're just interested in knowing what you're thinking. So write a topic. And if you think you can start to try to just draft where you think a problem is, please do that in the chat. And we're going to give you a couple minutes just to think about that. And then Daniel's going to help us to read a couple of those out. And we might actually, because I want you to read what other people are saying, I might ask that we have Daniel ask a couple people to talk to them. So just take a couple minutes here, just a thought, and we'll just let you be quiet amongst yourselves and then start writing.
I can give an example of something I'm kind of beating around while we're waiting on.
Good.
Oh, actually, no,
Thank you.
Dr. Elkins just put something forward, so we'll go ahead and start with that, Dr. Elkins. Uh, she says she's interested in faculty use of evaluations of teaching for courses and the potential negative impact emotionally, and how to improve the process of student input can be valued. Dr. Elkins, are you talking about um, the negative impact on faculty members?
Yes.
Yeah, we've all been there,
Yeah.
haven't we?
Yeah.
Yeah.
I think we've seen it. Well, you see a lot. But as far as it's being written about, I think in a lot of other publications that it is hard for faculty to find them useful at all. And I know that there's a lot of other methods for getting student input, but the one that I know that we use the most is the end of course, student evaluation of teaching. There's a lot of other ways, but we were just trying to look at how do faculty feel about them. Pretty sure I know how faculty feel about them, but actually trying to see if there's something we can do about making the input more useful from students. And yeah.
That's a great topic. And there's certainly a literature on biases in
Yeah.
those evaluations that you could draw on, and then thinking about what are some strategies to get, should the evaluations be about the instructor or about the student learning? There's, lots there. So that's a juicy topic. So, and you can see a problem to emerge in there that you could work on. That's great. We got any other volunteers?
I just
Yeah,
want to comment, Marley, for a moment on that. That is such a problem area. I know many faculty members don't even look at the student evaluations because they tend to be more personal than give feedback on the course or the teaching. So it defeats the purpose. It is almost sort of like, giving students the I guess it's sort of like the Yelp review or something when, you have an aggravated student who maybe didn't do well or something, but it's devastating for faculty. So I see several areas which could be considered problems within that topic.
Thank you.
yeah. But then I'll just comment too, I'm just riffing off it because it's such a cool idea. You don't want to completely get rid of it because there are some ideas that there's no other way to limb them, right? Except for anonymity and giving someone an opportunity. And so for all of the stuff that may just be very personal, occasionally you get that nugget of gold and you don't want to avoid that. You'd like to have a mechanism to find that out, but it's tough. Yeah. No, I think you've got a really good place here, Dr. Elkins. And I don't know, I'm not aware that there's been a lot written about this, at least not, I'm not aware of it if there has been.
I don't know about specifically in optometry. I couldn't find anything.
Mm,
I mean, there's a lot in general education.
Agreed, but not in
But
optometry. Yeah,
right.
great. Any
And then
other topic? We've got one more.
yeah, we do have another one. So Dr. Iqbal says enhancing clinical reasoning in complex dry eye disease cases.
Well,
Ah,
clinical reasoning is a topic near and dear to my heart.
Indeed.
I think really when you think about that, it is how do we guide students' clinical reasoning? How do we develop it as facilitators and instructors? We know that all of our students can reason. They have some critical thinking abilities, but how do we foster those? How do we develop them? How do we take it to another level? Because they are now in healthcare. They are taking care of someone's eyes. They have a responsibility for maybe someone's sight and their health. So I think that, within the topic of clinical reasoning, and once again, it applied to a complex dry eye could really lend itself very nicely to like a teaching case report. Um, but I think we still do have problems in teaching that thinking and thought process.
for sure. Yeah, and Fatima, did you want to add anything to what you wrote? Did you want to briefly make a comment? Appreciate that topic. Okay, I don't hear anything, shall we move on time-wise, but hopefully others can see the chat and emerge, and it might be something that you see, a topic that you've been thinking about too, and you might want to think sometimes about, is there conversations that can happen offline that you see common interests? Very good. So I'm encouraging you to think about identifying that there's a problem, and then thinking about that there's some kind of a gap, and that's what you're going to kind of get into in your article, in your story. And there are different kinds of gaps. So there's really 4 types that you might be coming across. One is there's a knowledge deficit. There's something we don't know. For example, this example here, no one has looked at the relationship between longitudinal integrated clerkships and medical student abuse. So it hasn't been done yet. And that's can often be in optometric education. We find, oh, it's being done in healthcare education, but not in optometry. So it could be, it's not been done. Another kind of gap is that it's some either methodological or philosophical shortcoming in the scholarship. Imagine reading about an article that says scholars have interpreted something, X, from a cognitivist perspective, but ignored the humanist perspective. So it's like we've taken this methodological approach to it, but we haven't taken a different one. So that can be a gap that you're exploring in an article. A third kind of gap could be a controversy. Scholars disagree on the definition of professionalism in medicine, and that's what you want to explore, something where there's different ways to do something, different ways to teach something. It's a controversy, and people aren't agreeing. And the final kind of gap that you might be identifying is something that's pervasive, but it's unproven assumption. For example, the theme of technological heroism is ubiquitous in the literature, but what is that belief based on? Maybe we kind of accept a certain thing, but it hasn't really been examined. So you identify your problem, then there's can be different kinds of gaps. So it's that thinking about the type of gap may help you to get at what the gap is in the case of the article you're working on. So imagine this introduction, that you've identified your problem, your gap, and your hook, why it matters. And you're then trying to, in the remainder of the introduction, lay out the little bit of literature that review that helps sort of shore up that problem gap hook. So imagine the gap that you've identified is that little is known about how teamwork training principles apply in distributed teams whose members work asynchronously in different locations. So let's go over and think of, you could probably come up with literature. There is literature on that poor team communication causes errors. So you could kind of make some kind of a statement and have citations. You also could talk about that team training could improve team communication, and there's literature that you could stand by for that. So we know there's poor team communication causes problems, but it's a trainable thing. And then the third thing is that there's interest in incorporating teamwork training principles into health professional education curricula. So now we brought in education. Yeah, we should teach teamwork. And that's something we could put some citations on. And then here's the thing that's interesting. Most of what's known about team training has come from research with co-located teams. So everybody's in the same room working on a problem. But optometrists are often working at a different time than the other healthcare providers on the same patient care. And so the teamwork is distributed, it's happening at different times, and yet we all need to work together. So The gap that's been identified here is that if we're training students how to do team communication based on a model that's everyone working together, but that's not what you do, we might need some research to help us. So the hook is healthcare teamwork is more distributed than co-located. So curricula are lacking until teamwork training principles are refined to reflect those distributed and co-located work contexts. So that example maybe starts to give you a way to think about how you would map out the gap in an introduction. So the idea in your introduction is in that first paragraph or two, start with the problem is. If you, in your draft, before you make it into the nice wording of your article, if you in your outline are going, the problem is, and answer that question. What we know is just, here's what we know about this problem. What we don't know is the gap, and this matters because the hook. And if you can answer those, the problem, the gap, and the hook, you've really set yourself up for a powerful article. So now we're going to kind of apply that concept of problem, gap, hook to a passage that's already been written and ask you to contemplate, do you see a problem? Do you see a hook, a gap? Do you see a hook in some order? So here is, I admit to being an author on this article as well, which means you have an opportunity. You may not like how this article works, the introduction, that's okay. But I want you to sort of see, can you find a problem? Were we successful in that or not? Or can you find the gap? Can you find a hook? So let's read this together. Effectively conveying serious news is an essential skill in optometry practice, and established protocols can help optometrists navigate these nuanced, emotional, and complex conversations with patients. Nonetheless, how best to teach these protocols remains a site of debate. Clinical educators need discrete strategies for making such pivotal communication skills learnable in an environment where patient care, teaching priorities, and limited resources are regularly juggled. Despite the importance of this competency, limited study has focused on teaching optometry learners to deliver serious eye news. In this article, we explore the need for serious illness communication skills in optometry and offer strategies to help optometric educators teach serious news delivery in clinical settings. So I'd like you on your own to read that again and see if there's a sentence that strikes you as a problem. Is there a gap? Is there a hook? And maybe to make it doable, just sort of write down on a piece of paper the first word of the sentence that you think is a problem. What's the one that's the gap? What's the hook? And then we're going to ask people to talk about what they thought was which. So take a couple minutes on your own and contemplate problem, gap, hook, anywhere in any order in that article. Okay, and I can use maybe if folk want to volunteer to say if they thought there was a sentence that was a problem, maybe turn on your mic and indicate what sentence strikes you maybe as a problem, and we'll see if others see it similarly or differently. Anybody want to jump in there?
It seems like there's a problem with the how to teach the protocols being up for debate.
So the nonetheless, how best.
Nonetheless,
So that sentence feels like an important sentence. And do you think that sounds more like a problem, a gap, or a hook?
I guess it could be a gap also.
Yeah, and it could be from the perspective that one of the types of gaps is a controversy. So some folk would identify that as gap. And are there other folk who saw this as a gap, this particular sentence? And if you didn't, that's okay. Did you see it as something else? Anyone else want to jump into the conversation? I am not able to see folks, so it is tricky for me to.
Nothing in the chat.
Nothing in the chat. Okay.
I can scan a little bit, Marley. I don't see anyone turn
Okay.
on their mic. I was wondering, Marley, is the limited study the problem? That there's limited studies on this, how to deliver serious news?
So later in there is this, despite the importance of this competency, limited study has focused on teaching learners. Yeah, so that's another interesting statement. And so I wonder whether folk think that's a problem, a gap.
Yeah, I would look at that and think it was more of a gap, because I would say that the problem is the thing we're studying, and the gap is the fact that the study is limited. That's the way I would look at it.
Yeah, and we did say that one of the kinds of gaps is a knowledge deficiency. So we don't know about it, and we don't know in the optometry setting much about this. So we've got two sentences that are being put forward, nominated for gap. Has anybody thought there was a problem being articulated in the paragraph? And don't worry, you won't hurt my feelings. Just interested in what folk think. Did anyone see a problem?
How to teach the skill, potentially that's the problem. How, I mean, I guess I nominated that as the gap too. So I guess I'm just all about that sentence.
Yeah. And April Lewis apologizes for not unmuting. She's on the train, but she says that
Oh,
I
good.
think the problem is that we need this skill. Pretty much what you said, Dr. Elkins. I think she's agreeing with you.
That how best to teach the protocols remains a cited debate, that maybe that's the problem. And so maybe sometimes a problem can be a gap, that we're missing something. It's, the way I sometimes think about a problem, it's the thing that gets the conversation going. It's the thing that people are really talking about. Like there are 3 extremely well-known guides for how to convey serious news. There's Guide, there's Spikes, there's ABCDE. There's several guides that help us, but how do you teach it is a different thing. Okay, did anybody see a hook?
Marley, I may be off topic, so I apologize, but obviously the goal is how to teach it. And is the problem, the barrier, what is getting in the way of achieving that goal? Could you look at the problem that way?
It can be sometimes, yes. It's the thing that kind of troubles us. It is the problem. It could be a barrier. It's the thing that gets the conversation. You know, you're at the cocktail party and people are talking about the weather. They talk about the thing that's interesting about the weather. It's what is the problem around the weather? You don't usually join the conversation, say, yeah, weather, eh? There's something that becomes the issue around the topic.
Sure.
Any last comment before we go on there that that's in the chat or anything?
Nothing else in the chat right now.
Thank you, Daniel. So this may not be what it should be or what you thought it was, but here is one way of thinking about it, is that I think my co-writers and I, what we aimed to make the problem is that we debated how to use these protocols, how to teach these protocols as a problem. And interesting enough, we put the why it mattered before the gap. We thought it mattered because clinical educators need strategies in an environment which is very complex. There's patient care happening, you're teaching, and you often don't have much time or resources. So you're trying to juggle a whole lot of things. So that's a complicated learning environment. So we thought it really matters that we figure out how to teach this. And the gap was not much has been done in optometry. This might not be a great example, but it's kind of fun sometimes to look at an article and see, can you identify that? So hopefully this was an exercise that just got you thinking about problems and gaps and hooks. And now we're going to turn it over to Daniel, and he's going to talk about some important things about methods and results.
Yeah, so we're going to go over a few of the different parts here: methods, results, discussion, conclusion, and just some ideas as you're writing this up. You've got your idea, you've got your problem, maybe you've backed it up with some research to say where the current state of the literature is, which is always a fun time to dive deep into the literature and see what other people have done. Helps you really refine that topic that you're going to write about. But now we have the question of what are we actually going to do? So methods, the best way to think about it is as the recipe. I believe Aurora kind of talked about this a little bit before, right? Ideally, you would like for a reasonably intelligent colleague to be able to take what you've written and your data sets and essentially do the work. Um, you may be aware, I don't know, of the replicability crisis that has been happening in some of our professions lately. Psychology has had a real concern with replicability lately. They found that a lot of, in some cases, seminal, very important findings that a lot of therapy had been based upon, in fact, could not be replicated when the same data were put through the same methods. This is a place where someone who's a little unscrupulous might be tempted to just fudge things a little bit to make the results a bit more exciting. Like, for example, in your methods, this is where you run your methods, particularly in statistics, and you find results that are so close to statistical significance, but you're just not quite there. And of course, the little devil on your shoulder then says, well, if I just adjust this and do this, then I can get to statistical significance. But of course, we can't do that, right? Those are the kind of little compromises that lead to replicability problems. Another thing that some people do is that they give just enough information to show that they know what they're doing, but not quite enough that somebody could follow in their footsteps. You'll see that sometimes too. People try to get that across. Not for us, right? Our job is to add to the total body of knowledge that is out there so that we can all know what actually is useful for our students and what is not. And so it's really important that we think about our methods as we're writing them out. Essentially, I would like my audience to be able to know exactly what I did, and if they had to, do it themselves and arrive at similar conclusions. So as long as you keep that North Star in front of you, you can't go too far wrong. Another thing to think about in methods is it has already happened. So as you're writing it up, use that past tense, please. Now, of course, depending on what you're trying to publish, they may have different publication criteria. But for the purposes of the optometric education section, you have done the methods by the time you write the article. So definitely write it in the past tense. Okay, some things to think about, some things you might include, and of course, this is non-exhaustive. You will want to indicate where your information is coming from, right? If it's a survey, if it's an interview, if it is grades, if those grades are designed and participants knew that they were going to be part of the study, if this is a retrospective analysis, all these data, of course, help us to understand as readers what we're really looking at, what it is and what it isn't. So let's be very clear about exactly where the data are coming from. Aurora mentioned IRB approval. It's important. And one of the reasons it's important, beyond just simply indicating the fact that you're behaving ethically, is that you want to reinforce to people who will read, younger scholars coming up, that an IRB is not just a boilerplate action you do because someone makes you. It serves a very useful purpose, right? An essential purpose. I came across recently some researchers in Europe who were doing a study on artificial intelligence chatbots that they created and then essentially programmed them to give false information on a Reddit thread. And they were studying to see how the opinions of the real humans in the Reddit community would change based on the false information. Well, but they didn't tell anybody they were doing this. So they ended up doing it, finding that in fact it changed people's opinions in very distressing ways, and then revealed it to the Reddit thread and were quite surprised when people were upset that they had been experimented upon without disclosure, without informed consent, all of those things. It's being called one of the bigger ethics violations in that kind of research in quite some time. So even if it seems to you like it's harmless, that's the benefit of having scholars you can trust review it. Thus the nature of the IRB. So make sure we indicate at least that statement that you have submitted to the IRB for an ethics review, even if they end up giving you a pass and saying that there's no real concern. Still, you want to indicate that you went through it. Subjects and participants, how are you sampling them? I know when I did a lot of my research, mine tended to be the courses I was teaching as convenience samples. And that's perfectly fine. I wanted to know how my students did if I created a certain intervention and put it towards them. But of course, it wouldn't have been ethical for me to give it to some of my students and not others. So I made it available to all. I would have to indicate in that case whether I had required my students to take it or offered it as an enhancement exercise. But then also, I would have to be very clear that I had no control, that this is a convenience sample. That forces you to ask the question of whether the students in your class are truly representative of the population at large. And what is the population? Can you take the information from your class of optometry students and say that that implies conclusions for all college students? Is it only other optometry students? Is it only other optometry students at your particular institution? And how will you distinguish those? By thinking about these questions as you're writing the methods carefully, all of these additional considerations that you'll need to consider later on come to mind. Data, right? What are the measurements you did? What methods did you use? Are you measuring with a survey? If you are, is it a standard free answer? Is it a multiple choice, multiple guess? Is it a Likert type scale? What kind of instruments are you using and how do you exclude people, right? What particular elements of the subjects or participants you're trying to use would you say this person cannot be involved? Be very clear about those if they're there. And if you don't know what they are, think about them a little bit before you even run the study. By the way, one thing I want to go back to quickly, sometimes it'll come up and it's a subtle distinction, but it might be an important one. And that's whether you call the people that are in your study subjects or participants. Subjects has certainly a little bit more old fashioned, which doesn't necessarily mean it's wrong, but it does have maybe an implication of a passive participant. somebody to whom things are being done or upon whom things are being done, whereas a participant has more of an appreciation, maybe, of a participant's activity and their equality within the study as much as it can be. That may be too subtle a distinction, and I don't think anybody is going to object if you use subjects or participants, but I think that's kind of the trend that the industry might be going in. So something to keep in mind, perhaps. Then you're also going to want to be very clear about what analysis tools you're going to use. Are you going to use qualitative or quantitative methods? If so, which ones? And what are you going to do with missing data? When you have a survey, for example, where somebody fills out 5 out of 6 questions, do you toss their entire answer? Do you use the answers they gave? If so, do you change the in if you're doing statistical analysis? What are you going to do? What's your plan? And being very clear about your tool so that once again, by identifying it, somebody can come behind you and run the same thing. It does no good to say we're going to perform statistical analysis. Let's be detailed here about what we're going to do. And anybody who knows about qualitative research will know there's a big difference between simply interviewing people and writing down what they said and doing a true, robust, grounded theory. These are all different methods that you can research a little bit more, talk to colleagues and about to understand what might be most appropriate. Being clear on the front end is really important. So we've got our methods down. We're going to talk about what we are going to do to address the problem, to fill the gap. Here's our plan. Here's our recipe. We're going to take 2 cups of flour and a dash of salt and a few eggs. We're going to mix them together in a bowl. We're going to put it in a baking pan and bake it at 400 degrees for 25 minutes, or whatever the case may be. We really want to be that specific in our methods. But now we've got a cake in the oven. And the question is, did it turn out light, fluffy, and delicious, or is it something we'd better forget? Well, that's what our results are for. All right, once again, results are past tense. By the time you're writing this up, you are talking about something that has happened. So let's stay in that past tense, please. Again, non-exhaustive elements you might include in your results section depending on what you've done. What was the response rate? This is really useful in survey data, which is a lot of what we do in education, right? You send a survey out to a whole group of people and your response rate is 5%. Well, that's a very different implication than if your response rate is 95%, right? There's a certain group of people that love taking surveys. They live for that. Well, those people may have very different opinions about a certain subject than members of the general population. So if you do get that 5% response rate, what does that say about the applicability of your results to the general population that's supposedly being measured? Demographic features may or may not be useful. They're usually worth including so that you are not the one trying to judge whether they're useful, but they can be helpful too. If you ignore demographic features, then of course you may not realize that your response sample is 95% male, or you may realize that but not share it with your readers, which could be that you've withheld some data that might be important to them. You never know the person, even if you have nothing to hide. Let's say you got a perfect 50-50 split between males and females. Well, maybe a reader might want to know how would only males respond if it was fully that, or something else. By including this, you help to kind of turn on those neurons in your readers and make them think, well, how can I do this and expand upon it in an interesting way? How complete were the data, right? How many missing surveys did I have to throw out? How many people didn't complete everything, started and didn't go through with it? Perhaps you might have people that start the research under an informed consent and then halfway through decide that they're done with the research project, right? You probably need to indicate how many people dropped out in that case. Sample representativeness of population. We talked a little bit about this in a few different places. You can't necessarily imply that your optometry students in your course are representative even of the totality of optometry students in optometric education. It could be they're representative of a particular time, but they are not representative of what happened 20 years ago in optometric education. There could be regional differences, or perhaps it might be representative to the entire population of human beings. It all kind of depends on what you're looking at, right? And you need to be able to justify it. One of the ways that I was able to justify when I was doing my research on the students, the convenient sample of students that happened to be in my class, was I would look at their OAT scores and GPAs upon entering my particular program, and I would compare it with those that were published for nationwide optometry students of the same year and of multiple years. I would do a little bit of a statistical analysis and be able to say, okay, it looks like this is a non-statistically significant difference. Therefore, we may be able to imply that what happened to this small convenience sample can also be applied to other optometry students across the nation. Whatever you do, the important thing here is to show that you've given it some thought and that you're not just making assumptions, but that you've done your work to make sure that the results you get are able to be applied as you say they should be able to be applied. Numbers, percentages, tables, and figures. Please, oh, please, oh, please include all of your numbers, all of your data, but don't put them in the narrative. The key again is to think about the person who is reading this paper. What is going to help this person to understand what happened, as well as replicate it if necessary? If you talk about the great database of figures that you were able to get from your methods, but you don't reproduce those actual numbers, then there's no way a person could reproduce what you've done statistically. But you don't want to put all those numbers in the narrative. That's what tables are for. That's what figures are for. Put it in a way so that the person who is interested in making a deep dive into those numbers is empowered to do so. But then in your results, you can be a little bit more vague, referring to the tables and then giving the perhaps statistically significant results in your narrative. Again, include statistics if applicable. You can tell by the way I'm talking that I like statistical, quantitative educational research. That's my game, but it's not for everybody, right? So if you're in the qualitative realm, which has its own types of rigor, just be sure you're following those areas of rigor, even though you wouldn't be using statistics. That being said, if you do use statistics, be clear about what you're doing. Be clear about how many tails the t-test has. Be clear about what your level of your p-level is, right? If you have to go non-parametric, explain why you have to go non-parametric. Is it because your sample size is too low and you suspect that if you had a larger sample, you would be able to get parametric data? Or is it just a problem with the data itself that is skewed? Try to be as comprehensive as you can so people, again, can replicate and run this test themselves. Do remember data are plural. A specific data point is called a datum. Data is a plural issue, so use those plural verbs when you are modifying it. So that's a little bit to take, but thinking about methods as a recipe and results as the resulting food item, right? That we're just trying to say, hey, look, I did this and the fluffiest cake I ever ate came out. Boy, oh boy, it didn't taste very good. That's kind of what we're talking about here, right? So what are thoughts? What are responses here? Questions about this, maybe even examples of studies you've seen where the methods weren't so good or the results seem to be biased as opposed to just clearly stating the results. Does anybody have any ideas here or anything they'd like to add, either in the chat or just through voice? How about my co-presenters? Putting you on the spot just a little bit.
Yeah, I know that when I'm reviewing an article or when I'm reading a published article, in the methods, if I feel like I couldn't repeat what they're doing, there's just things missing. What I find when I write an article, that I kind of write an initial draft and then I try to go back and reread it and go, did I include all the steps? Because I've kind of made assumption, oh, everybody will know about, and it's about the program of optometry where I am, and not everyone studies there. So maybe I need a little context. So there's often things I can add that will help people know, yeah, I could do this in my school, or I couldn't do that. So really trying to not make the world's longest methods, but make sure you got all the steps in there. I really appreciated that you highlight that importance, because those are questions that I ask when I read an article.
You know, it's important too, because we go back to the audience, right? The reason we're writing this up ultimately is to communicate with the reader. And so if we expect that we're publishing in optometric education, we may assume certain bits of common knowledge that would not come through a more general journal of education. We just need to think about who we're rewriting for and what is that person going to appreciate if they want to understand what's been done.
I also to comment is that an assignment in one of my courses that students have to critically review articles. And really in order to do that, you have to understand how the data was gathered and understand the methods. And it's funny because for the students sometimes sort of skip that part of it. But you really can't look at the rest of the article under, sort of a critical evaluation or critical appraisal if you don't really know, who was in the study, what was the inclusion criteria, how did they gather it? Was it blinded? Was it masked? If you don't know these important pieces, it's almost impossible then to comment about the results and even the discussion. So it really is a pivotal piece, I think, of is this a good, study, and to critically appraise it and look at the results and the discussion.
If you're like me, you've heard about some study, usually in the biomedical sciences, that has captured the attention of the press. People have amplified it and said, oh, scientists at blank institution have shown that this particular food increases your risk by X of this condition. And everybody is saying, essentially, not even that clear. They'll say, scientists show that this food causes cancer. And then you have a look and you realize when you look into the methods, which hopefully are written very clearly, that the percentage increase they've given is a infinitesimal likelihood. Increasing by 200% is still an infinitesimal likelihood, right? That may be an example. If the methods aren't up to snuff, then that cannot be limbed out. And ultimately, you're just basing yourself upon other people's opinions as opposed to the actual data. Are any of you familiar with the recent kerfluffle on Alzheimer's disease research? Have you heard about this? There is a researcher in California who is well established for many years as being one of the primary researchers in Alzheimer's, but he was essentially falsifying his Western blots in order to continue getting grants to continue doing his research. And so now there's a whole effort, now that it's come to light, of other researchers that are going back to his data and trying to see what the implications are. There are medicines that were being used as treatment for Alzheimer's that may not be nearly as effective as had been thought because this person lost sight of what he was there to do, which is to learn the truth and show the truth to other people who are interested. Whenever we have that other thing, whether it's getting your diplomate, whether it's becoming published for the fame and notoriety of it, or whether it's moving into another higher paying job or getting grants or whatever the case may be, anything that takes you away from that core desire to simply learn the truth and express the truth to other interested people has the potential to really cause you to lose your way. So just a thought. You're not going to be that person, though. Okay, now we get to the fun part, which is discussion. So introduction is a lot of fun. So I think is literature review, right? You really get to, if you enjoy being an author and writing and engaging your audience, this is the place where you really get to do it. Methods and results can sometimes be difficult because they're very factual, but discussion is where you get to be you. You are the person who understands this study better than anybody else in the world. And so now is your chance to say, as the expert on this study, what do you think it means? So let's go back to where we started. We identified a gap. Hopefully in your introduction, you made it very clear to your readers what problem, what gap there is in our current knowledge. This is your chance to say, did we fill it? And guess what? It's okay to say no. It's okay to say not completely. We thought this would do it, but here's what we ran into when we actually ran our methods. The cake came out, but it was fluffy enough, but it didn't taste the way we thought it would. Still, we made a pretty good cake. It just wasn't exactly what we were expecting. So, fine. Maybe you filled the gap perfectly. Maybe you didn't fill the gap. What's it going to take to fill the gap based on what you've learned? That's really useful information, particularly for your future research, but also for somebody that maybe might want to follow in your footsteps and take what you've done to another level. So I ask, have you filled that gap? What's the new framing of the problem if the gap has not been filled? Or maybe if the gap has been filled. We filled this gap, but the problem is not entirely dealt with. We just know a little bit more about it. So if we were going to take it to the next level, where is the problem now? Is it completely answered or is it only somewhat answered? Why does it matter? I took a research course once, and the instructor made a really good point. You need to be able to answer "so what" about 4 times in a row for your research to be useful. And if you can't, you don't really understand it. So I want to know if uh, higher achieving optometry students, what they think about group work. That was some of my research that I did, student attitudes to group work as it was based upon how high achieving those students were. So what? Well, maybe that might tell me a little bit about how to organize a class. Well, so what? Well, by organizing a class well, I can get higher achieving and lower achieving students to work together. So what? Well, I want my class to run so that lower achieving students learn from higher achieving students, and higher achieving students invest in lower achieving students because I think they'll learn better that way. I have to go through a few levels before I get back to the point, which is I want people to learn better, and that's why I'm doing this. So it's a good little exercise as you're writing the discussion to go through a few rounds of so what? Why does this matter? What did I learn? And where are the implications? And again, we're going back to our audience. An audience of optometric educators will probably need a little bit less so what than an audience in a general education journal. Then the question of what's next, right? Where are we going to go from here? If you, again, you are the expert on this topic now because you have just created this research. Based on this research, what's left to do? Where would you go if you had the time, if you had the resources, and you had the interest? Maybe you will do that, or maybe you're just setting up for somebody else. But so many young researchers have gotten their start by taking the what's next question that somebody else has made and just picking up that mantle and going on. Do your audience and the community of scholars the courtesy of very clearly indicating where you think this ought to go after this. We talked a little bit about this. Some things to keep in mind in addition to these elements. Remember, you're not repeating your findings. That's what the results are for. Sometimes you will see that in the discussion, right? People that just say, well, I found this. Well, thanks a lot. You just said that. No, you're summarizing them. You're saying, here's what's important, right? Here's what I think is important, what I think is significant, either because it achieves statistical significance or because when I was doing grounded theory, these were the themes that really seemed interesting and why I think they're important. As you're looking at the new framing for the problem, here's a good opportunity to compare and contrast with other studies that have looked at similar issues. This is a good place to talk about generalizability. No problem, Jill. Thank you. This is a good place to look at generalizability, right? We talked a little bit about it. In your discussion is a really good place to discuss whether you think this is generalizable, your results, and if so, to what population. Also, the only place where you can talk about your limitations and your biases. Uh, writing about limitations and biases is my favorite part of a study like this. I don't know why, it just happens to be. But I really like digging almost psychologically into myself because when you start a study, a lot of times your biases are unknown to you. Then you go through the study, you learn the mistakes you made, you talk to other people, and they say, well, did you think about this? Ah, I didn't think about this. And so, as I'm trying to become a better scholar, the place where I'm most able to improve is by looking at the limitations of my study, the biases that I had that led to those limitations, so that in the future I can do a better job. One thing to mention too is when you're asking why it matters, make sure you're including the application to optometric education in there, because that's what we're all here to do, right? So you could be very general on why it matters, because teaching is good. Well, okay, that might be a bit too general, right? Let's get down to why it matters for our population, which is optometric education. And we talked already a little bit about what's next, your future areas of study. Now you've got your conclusion. So this is summing it up. And show of hands for those people who are on video or would like to respond with a gesture. How many of you, when you need the answer or you need to figure out what a study says, you read the abstract and then you read the conclusion? Anybody ever done that before? I'm seeing a handful or two. We don't always have time to go in. We kind of trust that the researchers will be doing a good job. If we have some real concerns, we might go back and look at the methods. But a lot of times, all you're going to see is that abstract and conclusion. It's all you're interested in. Or there are some places that, because they are behind a paywall, that's all they'll show you. So it's important that you make a really good impression with that abstract and introduction and the conclusion. So this is your last chance to make a good impression. Let's make it a fantastic one. Go back to the problem gap, reiterate it, and talk about what you did to address it. State that relevance to optometric education, right? Because you want to make sure your audience, which is likely to be an optometric education audience, understands why this is important to them. And then this is a great place to leave just a few recommendations. Again, we're not being exhaustive here. You're not giving all your reasons why you're recommending the next steps. That's what the discussion was for. If somebody's interested in knowing why you think we should go to X or why this result is applicable in Y case, well, then they can go back and look in the methods, in the results, in the discussion.
Great, thanks, Daniel. That was really
Sure.
helpful. And so this next section and our last section really is on writing habits. It's really important to notice what works and doesn't work about your habits. And some of you may already be very aware of them, and some of you may not have thought about them. So we're going to just think about them for the next couple minutes. There are certain behaviors that you and I engage in. So the timing and the where, those are important things. Do you find that you're so scheduled in your work that there's meetings, there's teaching, there's clinics, that the one time that you're not scheduled for anything is Thursday morning? And so the question is, what do you do on that Thursday morning? Well, you've probably got so many choices, but is that the one option when you can have time to write, you do? So do you notice there's a when, or you say, oh, good gracious, if only during the day I could? It's after the kids are in bed that I have the first chance to open my computer and think about writing. How often are you writing? Do you write a little bit every other week, or is it more like kind of once a month? And how long is it? I've got 15 minutes, or you've got a couple hours. So paying attention to the timing piece, and then where? Is it at home? Is it at work? Are you in a room with other folk where there's lots going on? Or are you by yourself? So behavioral, think about, as I'm talking about these features, think about what you do on the timing and the where. And then there's other things to think about when you write, but sometimes they're called artisanal features of your writing habits. Are you more of an architect or a gardener? So the architect does a lot of planning. They write out an outline before they start to write, and they have written a lot of subpoints in every section. They kind of really planned it out. Or you're more of a gardener where you're planting some seeds over here and now some seeds over there, and you sort of see what comes out of it. So what's your approach to writing that way? Do you find your motivation is more of a push or a pull? You actually enjoy writing, so it's a look forward to, and you just want to have the time, but once you're there, you're feeling, yeah, this is great. Or is it the very last thing you'll do? It's a have to. You have done every other piece of your work. You have dusted the house. You have done everything possible you could do, and now there's no choice. You must now write. So what's the motivation that you feel? And does it, yeah, so that's an important thing to think about. And then the process. Are you somebody who you write something, you try to write the whole article and then go back and start editing? Or you write a section and then you say, okay, I got that section done. Now I'm going to edit it. And then I'll write the next section. Now, what's your process? Not to scare you, but what I tend to do is I write a paragraph, and then a couple paragraphs, and then maybe that's the time I had. And then I come back to it. Before I write something new, I go back to what I've written, and I end up editing it. So I'm happier with it. And then I add something. Maybe I only got one more paragraph added, and then I have to leave and come back. So there's a lot of editing. But what is your process? Just think about what that is like for you. There's not rights and wrong here. It's about being observant and noticing the things that kind of feel like they work for you more and the things that don't feel like. Social, what are your social writing habits? You must be so solitary, no one other human could be even breathing in the room for you to concentrate on your writing. Or the kids are still up and they're on your lap and you're trying to write. Or you like to write with a colleague. You're going to ultimately work on an article and you're saying, okay, I'm going to work on this section, you're working on that, and you feel kind of comforted while you're both working. So what is your social habits around writing? That's good to be observant about. And then there's the emotions. Do you feel happy when you write or frustrated? Do you feel open to the possibility, or do you feel like kind of scared and vulnerable? I would tell you that I enjoy the process of writing, but I find it hard. Takes me a while. And that image of the stuffing ripped out of the stuffy is kind of how I've sometimes felt after some reviews from journal reviewers who've been a bit, in my opinion, cruel, not constructive. So I have experienced all emotions through the writing process. But it's good to know what emotions do you experience while writing. I was meeting with a colleague just earlier this week, and she said to me, I don't like writing, I like thinking. And so she loves when she's working on a paper with someone and they've written something and she can just think and then help them with it. So we all have our strengths. So note those different features of what your current writing habits are. Don't judge them. But a tip that I've heard Lorelei give, and I think it's a good one and it has helped me, is think of one of my habits that seems useful, productive, and think of one that's maybe not as productive, and try to nurture one good habit and maybe try to downplay one that seems to get in your way. That's kind of a doable goal. So think of that. And if at the beginning when Aurora was having you think about your strengths and challenges around writing, reflect back on that. What's the biggest thing? Often is Aurora said, like, time gets to be an issue. Well, what can you do to help yourself around that time? Is there a place when you can compartmentalize and get some writing in? So just think about that. Don't judge it, but see if you can support yourself. Some tips for you to think about writing. It will help if you can write regularly. If you're writing once every few months, it will feel hard. You won't remember what you wrote before, and it'll feel like a exercise you haven't done for a while. You got to get the muscles kind of used to the work. So if you can find a way to get an hour or 2-hour block regularly, that's great. And even if it's not a whole section, write some regularly. Sometimes people find that they like to write the easiest part. Maybe they say, oh, I'm not ready for this, quite ready for the introduction and the discussion yet, but I'm going to write the methods up because I know what I did. So that's the first thing I'm going to write. What did I do and why did I do it? Get that. So start with whatever is easiest for you. Always, of course, striving for clarity is an important thing. You want your readers to be able to work through the article. When you've got that article done, and especially if you're working with others, read the article for flow. Can you tell that 4 different writers were involved because somebody wrote the methods and someone wrote the results? Try to make it a similar voice and that the article flows through. And sometimes I know I've had the feeling when I finally get that first complete draft of the article, it's like, I'm not done. There's the only, I can celebrate it, and I should celebrate the articles now in a complete set, but there's editing to be done. And so edit away, be hard on yourself. And that's important process, like get help, get feedback from others, get someone trusted in your work that can help you and give you some feedback where it could be a little clearer. Avoid long sentences. If you've got a sentence that's 60 words long, it probably could be broken up, and it's probably going to stump your reader that they have to read 3 times before they get your point. So look for things like that. Where you can, use an active voice. Now, we've been trained in healthcare and in that kind of medical voice, and that's a tricky thing because, we often write the visual fields revealed, blah, 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 as if the visual fields were magic and no human ever touched the instrumentation that did it. We don't say, I found X on the visual fields using this program. We say the visual fields revealed. So we're very passive in our writing often, but try to write in an active voice where you can, though keep in mind Aurora's tip early on about look at your journal, pick your journal early on, because they may have guidance around how to write. Like, can you use first person, for example, or you must not. Again, getting feedback before you submit is a really important. Don't use your reviewers as this is the first human set of eyes to see it. Get someone you trust to help you, and just keep trying. I've had lots of reviews, some of them always the article has gotten better through the review process. What I hope for from reviewers is constructive comments to help me improve it. Sometimes reviewers are a little destructive along the way, but hopefully you can have your emotional response to that part of the review and then move forward because it can get better. We've focused on a number of things here this evening, but of course, there's other features that you may be looking at for help. And what we wanted to remind you is on the American Academy of Optometry website, if you go into the optometric education section and look for the Become a Diplomate, we've put in the optometric education diplomate section, as well as the guidelines for doing diplomate, which may be useful to some of you who are doing or planning to do it or are doing the diplomate. And in the last couple pages is an appendix that really gives detailed information about article structure. But keep in this mind this new resources. There are several short articles about how do you design a survey, or how do you analyze educational research, or some writing tips. So keep those resources in mind. That can really be helpful. So wanted to point that out because in time constraints of this time, we're not talking about every feature about doing optometric educational research. I just wanted to point out before we just take one final thought is any of the articles that we've mentioned here today are in a reference at the end, and we'll figure out how you can have access to this slide deck if that's useful to you. And there is in this slide deck our contact information if you've got questions later. We're happy to be of help. But just in our final couple minutes, interesting if anyone has any thoughts about the problem that they're interested in. We heard about student perception data evaluation of faculty. We've heard about clinical reasoning as a couple things. Is everyone have any more thoughts about the specific problem that they're thinking about, or maybe just a comment on whether they find this idea of a problem gap and why does it matter? Do they find that heuristic useful to them? So if we can turn that open to anyone who wants to make a final comment or ask a question, be happy to hear that.
No, it's like all minds are clear.
Okay, excellent. Well, we really want to, on behalf of the Optometric Education Diplomate Committee, you're all busy humans. We're really happy that you joined us this evening. Hope you found it that there's a couple tips in there through this past not quite 2 hours that you found could be useful to you. Keep in mind that we're available to be useful, and you might be writing to think about doing the Diplomate. You might be in the Diplomate program, or you need more information about that. Let us know if you need any help in knowing where to look for that. So just wanted to thank everyone for joining us this evening, and happy writing and good luck with the writing projects that you're working on.
Hopefully seeing everyone in Boston this year.
Right on.
Yes,
Absolutely.
hopefully so.
Should be good, wholesome fun. All right. Peace and take care, everyone.
Bye-bye.
Good night.
Good night.